The White House weighed in yesterday and said that it will not be mandating vaccine passports. It's something that's been a little bit of a hot button issue. You've had governors in some of the southern states, Governor Abbott from Texas, who came out swinging against this. DeSantis in Florida looked like he would do the same thing. Where do you come down on vaccine passports? And without a mandate coming from the federal government, where does that leave employers or companies that might have wanted to use these things? Are they dead in the water?
Yeah, I think we've been thinking about vaccine passports through the wrong lens. I think that the way they're likely to be used is really to create two lanes of access to different venues. One that's going to require maybe some testing, some secondary screening. And the other is going to be a fast lane where if you can demonstrate that you've been vaccinated, you're not going to have to bring proof that you've been recently tested. You're not going to have to go through some secondary symptom screening. So it's going to be like an easy pass where you can either go through the fast lane or if you still like to pay the toll booth because you think the police are tracking you with the easy pass device, then you can stop and stand in line and pay the toll booth. So I think that's the way we need to think about the vaccine passports. And the reality is right now, the only people who own the information reliably that you've been vaccinated is the state. That makes no sense. People think they have proof that they've been vaccinated because they have the paper card, but that's not going to be good enough. That paper card can be printed off the internet right now. So you actually don't own evidence that you've been vaccinated. Sometimes your doctor knows because the pharmacies have been notifying physicians. Sometimes your health plan knows. So if you're in Medicare Advantage, they've been notified. But for the most part, the only people who have proof that you've been vaccinated is the state. That makes no sense. So this is about empowering consumers with the information around their vaccine status.
Hey, Doctor, separate question. I don't know if you were watching yesterday, but Joe and I were talking about the possibility of excess vaccines and how they should get distributed around the world if, in fact, we should do that. There seems to be sort of a multi-layered conundrum here or questions. Should some of these vaccines be returned to a Pfizer or Moderna, let them distribute them, let them capture some of that profit with the idea that then maybe in the fall there would be additional vaccines potentially that address the new variants provided back to U.S. citizens? Do you give it out for free and do it yourself? Do you not? Do you keep the entire stock for yourself because you're worried that there are going to be new variants, but maybe just having a third booster will take care of it? And obviously, even now, we're just talking about whether you could surge the vaccines that we have even now to the right states. So there's a lot there, but I was curious if you could break down your thoughts on it.
Look, I think we should be thinking about a PEPFAR-like program for distribution of COVID vaccine around the world. And there's going to be plenty of supply coming into the market. I think the U.S. government is going to stockpile a certain amount of supply to have it on hand to give people boosters in the fall. But beyond that, there will be supply that we could give to other nations. Probably first in line should be Mexico, our neighbors, to try to help our neighbors and make sure that they can get their epidemics under control. But there'll also be supply for low-income countries. The U.S. government, in order to facilitate getting that supply into those markets, whether it's coming out of the supply that the U.S. government has already stockpiled, which there'll be some there that they could probably share, or the supply coming online with the manufacturers, I think that you need to provide logistics in those countries. You need to provide indemnifications so U.S. manufacturers don't spend the next 20 years in court. And as you know, I'm on the board of Pfizer, one of the companies that would be participating in any kind of effort to try to make vaccine more widely available. The companies are already donated through COVAX, so there is vaccine being made available, but that isn't a high throughput operation. I mean, they can go into certain markets and provide a real benefit, but to do this on a massive scale, I think is going to require the logistics and resources of the U.S. government. So we should be thinking about that kind of a program.
Hey, Scott, the CDC last week was talking about how if you have been fully vaccinated, you don't have to come back and quarantine at home after you travel domestically. Internationally, that's not the case. There are stricter guidelines because we're still on alert with that. How safe do you think international travel is, and how long would you anticipate before those restrictions are changed for international travelers as well?
I think Europe's probably about a month behind us right now. Hopefully, we don't have any kind of real, true fourth wave confluent epidemic this summer. I don't think we will. I think that we're seeing sort of the last throes of this right now, and these hotspots hopefully will resolve over time as we get more vaccine into these parts of the country. So I think that you'll see international travel open back up. Again, it comes back to what it's always been. if you're in a high prevalence environment and there's a high likelihood that you came in contact with the infection, even if you've been vaccinated, you need to be careful. People can still get sick just because they're at much lower risk of getting the infection, much lower risk of transmitting it. Lower risk is a no risk. And I think the real consideration needs to be around if you have people around you who haven't been vaccinated, who are vulnerable to the infection, you could still be an asymptomatic carrier, so you need to be careful in that regard. So I think that's why vaccinated people should still take some precautions in a high prevalence environment, particularly if they're going to be around people who are unvaccinated at high risk. Those are the kinds of considerations I would be making.
Shepard Smith here. Thanks for watching CNBC on YouTube.